disorder, where the lung capacity begins to decrease day by day, causing the patient to experience shortness of breath. In such cases, the medications given are intended to reduce autoimmunity, but they are still not very effective. Recently, stem cell therapy has provided quite good results, which are reassuring.
Lung fibrosis or interstitial lung disease is a serious condition affecting the lungs and is considered an incurable disease because there is no definitive treatment that can help patients improve. In the case of such a serious disease, stem cell therapy has come as a blessing, and it is important because in interstitial lung disease and lung fibrosis, doctors ultimately advise lung transplant, which is extremely risky and also a surgical procedure. If we can provide relief to such patients by transplanting bone marrow cells, placental tissue, or mesenchymal stem cells, it would be a significant achievement. Placental cells are only permitted as part of clinical trials, while currently we are able to use only autologous bone marrow cell transplant in clinical practice. It is important to note that obtaining the patient's consent before any step of the transplant is crucial. ILD is mainly caused by exposure to environmental pollution and chemicals, and it has been observed that those who work in factories are significantly affected. In such cases, stem cell therapy has shown very good results when the stem cells are administered through the blood via the muscles. Patients who are continuously on oxygen support are now also being given stem cell therapy, and it has been observed that this reduces their oxygen requirements and as a new treatment option that helps patients by regenerating lung tissue, reducing their oxygen requirements, and improving their quality of life.